Thank you, Jenny. And thanks for this opportunity to look back 30 to 35 years ago. And I was thinking, there are a lot of you aren't even 30 years old yet, right? And then the other weird thing is to be the first person in a line of presidents knowing that everybody who preceded you is no longer with us. That's a strange feeling. So, but I was a baby. As Bev says, I was a baby. When I became president, I was 26. Okay, so, but I need to say up front, I want to tell you, and for those of you who are here that are under 30, get involved. I want to say that my, particularly the first 10 years of my involvement with ISNA probably were the most meaningful and educational professional experiences of my entire career. I mean, they were just amazing. So anyway, I was asked to reflect in the context of the Code of Ethics. And I would share with you that the principal drivers for all of the work that I'm going to highlight fairly quickly, and believe me, I have enough stories for an all-day session, but to highlight are driven by provision 2 and 3. Okay, in terms of our commitment to patients and our duty to protect the health and safety of patients. Now, my presidency started in '77, but I'm going to start a little bit earlier for context for '77 to '81. And then also, not just for context, but to share with you some information about ISNA that many of you might not remember or just don't know. In 1970 to '72, we had, and all of these were just phenomenal opportunities for myself and others in this association to make significant contributions to the discipline. But ISNA was forward-thinking, and we started a committee to develop standards of practice. And we established standards of practice for the Indiana State Nurses Association because there were no standards of practice, none. And the reason I'm sharing this is because the American Nurses Association at the time did not have standards of nursing practice. And the interesting thing is that when it was either 80 or 81, I don't remember which, we got a letter, and no, it wasn't that. It had, because Lucretia Saunders was still executive director, so it had to be 77 or 78, 79. We got a letter from the American Nurses Association that was a little bit threatening, saying that we had plagiarized the American Nurses Association standards of practice. And we wrote a letter back to them, nicely sharing with them that, oh, that's interesting, because our standards of practice existed and published before yours, and your language, which we had shared this with them, looks a lot like ours. So anyway, we didn't hear anything else from them. But anyway, right after the standards of practice, and I was chair of the legislative committee, again at a very young age, and Linda Shin came on staff. She was young age too, and she and I were partners in crime. But the wonderful thing about all of this was that we were young enough and energetic enough, whippersnappers, that we didn't know that anything wasn't possible, okay? So with the help of a lot of phenomenal members in the association, we decided what we needed to do was to change the scope, not change it, establish a scope of RN practice for the state of Indiana. Now, there was legislation, statutory recognition of RNs and LPNs in statute, but there was not a scope of practice. It only said that to be a registered nurse or an LPN, these are what the educational requirements are. And what RNs did was all delegated by physicians. There was no autonomous scope of practice for nurses, none. So when we decided we wanted to change that, and North Carolina, which was the first state, and the second state, which was New York, established an autonomous scope of practice for nursing. And I had a wonderful opportunity to spend time with Veronica Driscoll, who was the executive director of the New York State Nurses Association, and to learn about their strategies, et cetera, on how they accomplished this. So we spent a lot of time, Linda and I and others spent a lot of time establishing good relationships with the physicians, good relationships with several key legislators, and we were successful in about 1973 establishing a scope of RN practice in statute that recognized nursing diagnosis and nursing interventions. Now, I think this is one of the few times where legislation preceded what was actually happening in practice. So we had made an incredible case with physicians and with legislators about why we needed to have an autonomous scope of practice that included nursing diagnosis and nursing interventions. And we were driven by, I want to share this quote with you, okay, because this is very significant. And we use this with the Medical Association, as well as multiple other examples of harms and potential harms to patients because nurses were not given by law the authority to practice nursing without those activities being delegated by physicians. Do you with me? So we shared lots of examples, and that's what helped us get this passed. But I want to share this Florence Nightingale quote, which says this pretty succinctly, written in 1860. In watching disease, both in private homes and in public hospitals, the thing which strikes the experienced observer most forcibly is this, that the symptoms and sufferings generally considered to be inevitable and incident to the disease are very often not symptoms of the disease at all, but of something quite different, of the want of fresh air or of light or of warmth or quiet, or of cleanliness or of punctuality in the care and administration of diet, of each and all of these. If a patient is feverish, if a patient is faint, if he is sick after taking food, if he has a bed sore, it is generally not the fault of the disease, but of the nursing. 1860, okay. That's what drove us and motivated us to get this done. But then, what we needed to do was travel the state, going to, Linda Shin and I and others went to all of the districts in the state. We went to hospitals, had all kinds of educational sessions. I wrote a monograph that was distributed throughout the state to teach nurses what a nursing diagnosis was. Because, you remember that? Because nurses were making lots of judgments, but they weren't thinking of it as a diagnosis. And then around that same time, 1976, 77, 78, 77 when I became president, then there was a lot of confusion about nursing diagnosis because that was in the midst of the throes of and the evolution of the nurse practitioner movement. So people were saying, because of the threat from medicine, that a nursing diagnosis was any judgment a nurse made, because the nurse had the knowledge to make it. Okay, so it was, I remember because I went through a nurse practitioner certification program, that's what we had in the early 70s. And in that program, they said to me, you know, it's a nursing, when you judge that a patient has congestive heart failure or you see a kid with otitis media, it's a nursing diagnosis because you had the knowledge to make it. So then I took my VW Volkswagen into the VW Diagnostic Center, and the mechanic says to me, which I did, I had an incredible cold. And I thought, see, this is not a VW mechanic's diagnosis. So we became increasingly clear that a nursing diagnosis is a judgment that a nurse makes about a problem or a potential problem for a patient that is amenable to and requires nursing interventions, which are non-pharmacological and non-surgical. So anyway, we spent a lot of time educating nurses throughout the state for this. And by the way, Indiana was the third state in the country to recognize nursing's autonomous scope of practice. Now, although we were the third state in the country to do that, we did not have mandatory license, okay? 46 other states, you guys remember this? 46 other states had mandatory licensure. Now, what did that mean? That meant that anybody could call themselves a nurse. And we were having a lot of problems with this, and we were concerned about patients, and particularly, there were a lot of problems occurring in homes where people were representing themselves as nurses and they weren't. And this because there wasn't mandatory licensure, the State Board of Nursing could do nothing about the complaints that they got because they had no jurisdiction over these people. So anyway, that became the next priority. So in 1979, 81, that was a primary goal of our work in the association. Now, this became really interesting because the context for us trying to accomplish this, and by the way, previous presidents and members of the association had tried to accomplish this 2 times before, but unfortunately were unsuccessful. One of those presidents was Emily Holmquist, who worked her tail off trying to get this done. And anyway, the time just wasn't right yet. But in the context of 79 to 81, we were in the beginning throes, some of you will remember this, of the development of a critical nursing shortage. You remember this? Critical nursing shortage. I mean, we talk about a nursing shortage now. I mean, this was to the point where, and I was, the wonderful thing, the nice thing for me from 77 to 81 was I was a full-time doctoral student. So I had a lot of flexibility in my schedule. But I remember Sally Knox, who was the VP of University Hospital, coming over to the School of Nursing asking us, faculty and graduate students, to work at University Hospital because there weren't enough staff. So that's scary. but anyway, you remember? So, what? So anyway, so we're in the midst of a nursing shortage. And then we also have 2 significant adversaries in the legislative body, in the Indiana General Assembly. We have a physician by the name of Ned Lampkin, who was absolutely distraught that we were successful in getting this autonomous scope of practice because he viewed nurses as handmaidens. And he had a very, very good friend and colleague who was also a member of the House of Representatives, and I blocked his name out. He was an attorney, but he was chair of the Ways and Means Committee. But this will become significant in just a moment. And then the third person was Senator Richard Miller, who was chair of the Senate Public Health Committee, who never saw fit to claim a conflict of interest because he owned basically the major system in the state for nursing homes, who were having a hard time finding staff, and you can appreciate that. I mean, that was difficult. But the last thing he wanted was mandatory licensure for nursing. Now, we had developed over time a great relationship with Senator Charles Bosma, whose son is now Speaker of the House, but a great relationship with him. And he vowed to help us get mandatory licensure. Now, the other thing that was occurring, though, at this same time was the sunset legislation. You know, every state, I can't remember now if it's every 10 years. What is it, Ernie? About every 10 years, the legislature is, by law, required to review all state agencies and to determine if there's a need for them to continue to exist, and also to revise any statutes and/or regulations that might be governing that agency. And anyway, it's a huge piece of work, generally requiring well over a year, with a legislation that's like about this thick. I mean, it's huge. So this is going on at the same time. So the State Board of Nursing is under review. Well, Representative Ned Lampkin thought, there is no need. There is no need for the State Board of Nursing. And the reason there's no need for the State Board of Nursing is that all nurses do is what we tell them to do, which means they don't even really need a license to practice as a registered nurse. Do you remember that? So, and I've decided, if you want to increase membership in an association, tell nurses that the legislature is going to take their license away. Because our membership just exponentially increased. So anyway, so that's the context in which we're going into the General Assembly to try to get mandatory licensure. So Charles Bosma, he's the primary sponsor of our bill, and it starts in the Senate. And of course, that bill is assigned to the Senate Public Health Committee. And Senator Richard Miller was refusing to hold a hearing. If you have no hearing, it's dead. So, and I still, honest, when I reflect, I can still picture him in the hallway, because I waited for him to come out of a committee, because he wouldn't take any calls, nothing. And I waited for him to come out of the committee room. And, you know, you got to remember, I'm 26 years old, okay? Well, by now, I'm 29. So, and he comes out, and I said, Senator Miller. Of course, when he saw me, he's kind of like saying, oh, yeah. So I said, you're refusing to hold a hearing for our bill. And he said, yes, I am. And I said, can I ask you why? And he said, because I haven't heard a thing about the public caring about this. I said, oh, really? He said, yes. And I said, so if you heard from the public, then you would care about it? And he said, well, I'd have to. And I said, okay. So I left, and then Linda Shin and I went around, okay? I mean, we got publicity like you wouldn't believe, even talking with different radio stations in smaller communities about the need for mandatory licensure for nurses, and guess what? And we told everybody to write Senator Miller. Okay, so the public did, okay? So because of that, he scheduled a hearing. Now, he still was going to do everything he could to prevent us from getting this. However, nurses from all over the state came in busloads to, remember that? Came to the State House, and on the steps were the TV cameras, and I mean, it was absolutely incredible. And it was the most elated professional experience feeling I've ever had my entire career. To see all of you, many people who are no longer with us, swarm the State House to get this done. But it passed out of committee. Okay, so then it goes to the House, and there's our dear friend, Representative Lampkin, and his best bud, who's the chair of the Ways and Means Committee. And the Speaker of the House, who's also friends with these two, doesn't assign this bill to the House Public Health Committee, instead assigns it to the Ways and Means Committee to kill it. So, how do we get around this? So Linda and I met with Charles Bosma, and we had developed really good relationships with some of the representatives in the House. So this was the strategy. When the sunset bill that they had worked so hard on for so long, this many pages, came up on second reading, where many of them don't pay attention. Okay? This House of Representatives members would introduce our bill as an amendment to the sunset legislation, because it was a state agency-related amendment. And it passed, okay? So, then it goes to third reading, where the final vote is, and here's Lampkin saying, again, because how can you not pass this bill with this much work in it? So anyway, we were successful. We were the 47th state in 81, in accomplishing mandatory licensure. And then just one last note. To help with the economic viability for the future of ISNA, and Ernie's sitting over there saying, yeah, right. The board decided that we needed to own our own building, because every year, every couple years, because our lease, I can't remember, was for 2 or 3 years, the leasehold cost for the building, that space that we had, was consistently going up. And we knew that this was not going to be good for the association. So we started a building fund, and thanks to Maggie Fuller, who is no longer with us, the association was successful in raising money and purchased and opened our building, ISNA's own building, with enough space for some rental property in 1980. So anyway, those are my fondest memories, and I hope that some of you learned something about ISNA. Thank you. Brenda?